This is Saw Palmetto, and I'm Callie, and I'll be working with Jen Dunn today. So what is saw palmetto? It's a palm-like plant with berries that is indigenous to the southeastern United States. On the left is its raw form, and on the right you can see it's made into capsules for easier intake. So who's going to be using this? So in the 1900s, it was used for UTI treatment and increased sperm production. Today it's going to be used for BPH, which is benign prostate hyperplasia, which is a non-cancerous enlargement of the prostate gland. It's fairly common. 40% of men over 60 and 90% over 80 are going to be developing it. On the right is a picture of what that enlarged prostate will look like. So what are the effects thought to be?
We're not quite sure what the effects are. The thought is that it impacts testosterone levels that are involved with hyperplasia of the prostate, and it may also have an anti-inflammatory effect on the prostate. And one study showed that when combined with lycopene, which is found in tomatoes, and selenium, the anti-inflammatory effect is increased. So let's look at what's really happening at the biological level. So what happens is saw palmetto possibly inhibits the enzyme called 5-alpha reductase, which converts testosterone into dihydrotestosterone, so also known as DHT. And it is DHT that's thought to be responsible for enlargement of the prostate. So saw palmetto prevents DTH, which hopefully prevents enlargement of the prostate.
Some of the ADRs, so these first two drugs on the left are actually similar, so you don't want to take those because it could impact and overinflate the levels of hormones in your body. Birth control, again, I don't know why men are taking birth control, but it's on our list. It's going to impact your levels of estrogen. Some other drugs can cause nausea, vomiting. Ibuprofen and naproxen, you're going to see increased bleeding risks, and if you're taking warfarin, it could actually increase your chance of developing a clot. So again, those similar drugs are Proscar, which is used to treat urinary retention, and Permixone, which also treats symptoms of BPH, so you don't want to be taking them at the same time. Some side effects are going to be nausea, diarrhea with people who are taking large amounts, so it's important to follow your recommended doses. Fatigue, headache, abdominal pain, could be decreased libido or ejaculatory dysfunction, and rhinitis, which is hay fever.
So a little bit about logistical things about saw palmetto. It's normally taken as 320 milligrams once a day or 160 milligrams twice a day. So looking about 320 is a normal dose. It might take up to 8 weeks before you start seeing any effects of saw palmetto. And the cost, it's a relatively cheap drug, $6 to $20 a month for saw palmetto. So what are the studies saying about it? There's a little bit of disagreement on the effectiveness of saw palmetto. A few of the studies we looked at showed no effects of saw palmetto versus a placebo, even when subjects were taking 3 times the recommended amount. But the majority of the studies we looked at did see some effects from saw palmetto, effects as decreased DHT levels in the prostate, which again is responsible for enlargement of the prostate, decreased prostatic epithelial tissue, and what the subjects are really looking for is improving their peak urinary flow rate and decreasing nocturia, or how many times they have to wake up at night to go to the bathroom. Something notable was that 88% of patients and physicians were satisfied with saw palmetto's effect on the symptoms of BPH. But it's also notable to recognize that saw palmetto seems to decrease the symptoms of BPH, but it does not actually decrease the prostate size. So would I recommend this to my dad, not as a PT, but just as a family member? I would, because BPH is cheap. It has few adverse effects. The only way I wouldn't recommend it to a family member was if they had any contraindications, which would be that they're taking blood thinners or they're already taking drugs that affect androgen levels in their body. Thanks for watching.